Going to stay there, going to stay on the warm side of the more seasonable mid-70s, whereas we've been much cooler the last couple of days.
And probably no coincidence that the humidity brings the possibility for those storms either then, too.
Hey, got a meteorology degree there?
I did ninth grade earth science.
Yeah,
so,
there you go,
we
there
have
you go.
that going for us. Thanks, Brandon. Well, there's still a cry for help coming from the business owners who lost everything the week of the George Floyd protests and all the unrest that unraveled from that as well. Some haven't been able to get permission to begin demolition. Reporter Alex Jokic explains why.
Yeah, this was the restaurant kitchen right here.
This pile of rubble is a daily reminder of the night Ruhel Islam's American dream burned to the ground. The riots following George Floyd's death were more than 2 months ago, and his restaurant, Gandhi Mahal, is still in shambles.
We want to come back very strong. We want to make, because the whole world is looking at us.
The first step in rebuilding is clearing all of this out, but right now he can't. A state statute won't allow demolition of a building until property taxes, which are normally due in the fall, are paid in full up front. Islam says for him that would be about $15,000 at a time when their restaurant has no cash flow. They've lost hundreds of thousands of dollars from not being open.
It's ridiculous to hold up demolition over that.
Minneapolis City Council member Andrew Johnson says the city's hands are tied when it comes to these permits. They've reached out to lawmakers to change the rule.
Common sense is that this situation is so terrible, and we should be doing everything we can to help these small business owners rebuild and recover.
Nearly 1,500 buildings were damaged in the riots by fire, vandalism, or looting, according to the state. And for many, these ongoing roadblocks are extremely frustrating.
Small policy change, small this can make it better, make it more welcoming for us, easy for us.
Islam just signed a lease for a new temporary location, but he hopes someday to rebuild what's been lost on the same grounds where his dream began.
Alex Jokic with that report. And as we have reported, Governor Walz is asking the Small Business Administration to approve low-interest loans. Still ahead, how many states on the East Coast got hit by Tropical Storm Isaias and are working to make repairs in its aftermath.
Well, as we begin our Wednesday, let's take a look at how things are shaping up at the Range Regional Airport in Hibbing. We've got a couple of clouds out there. Temperatures are a touch cooler than yesterday, 44, calm winds right now. But unlike yesterday, instead of being stuck in the lower 70s, we'll see some mid and upper 70s out there across the Iron Range and much of the region. And winds will be a bit mild out of the southwest, partly cloudy skies.
A 30-degree difference there. All right, Brandon, I bet they'll be preparing for that. And now it's time for this morning's Tech Bites from ABC.
In today's Tech Bites, payouts for former users of Google+. A class action lawsuit was filed last year when the social network shut down amid privacy concerns. Customers can now get up to $12 from a $7.5 million settlement. You must first file a claim to get the cash. UCLA is beginning a 3-year study on depression and anxiety with help from Apple and its devices. It will examine how sleep, physical activity, heart rate, and daily routines. The study will use data obtained by Apple Watches, iPhones, and the Beddit sleep tracker. And the flight of a giant metal thermos could be a prelude to humans reaching Mars. SpaceX sent its Starship prototype on a 500-foot high test hop in Texas. The final version of the spacecraft will be 400 feet tall. Those are your Tech Bites. Have a great day.
And now to the destruction caused by Tropical Storm Isaias as it roared up the East Coast. At least 6 people are dead. Millions more are without power. The storm slammed into the Carolinas and barreled up the coast all the way to New England. ABC's Mona Kosar Abdi has the details.
Overnight, nearly 4 million power outages along the East Coast. After Isaias tore a path of destruction, this tree smashing into a home in Massachusetts.
I couldn't imagine anything this large coming down, and the way it's come down, it just totally uprooted the thing.
In Philadelphia, the Schuylkill River is projected to crest today over 15 feet, its highest level in more than 150 years. On Tuesday, rescuers outside the city pulled these kids to safety from a second-story window.
I'm pregnant, so I was at an OBGYN appointment. I left maybe a little bit before 10, and it was definitely not like this.
Joseph Hicks says the wind destroyed his Delaware home as his family took shelter inside.
As we were approaching the basement, I saw the tree lifting up out of the ground. And at that point, that's when I saw the whole back of the house coming off of the property. First thought is, thank God that we're here. God spared my wife, and my boys, so we're here. So I can replace a house.
But the storm turning deadly for others. In Maryland, a fatal accident when a tree fell onto a car. In Queens, New York, one man died after being crushed in his truck by a fallen tree. And in North Carolina, 2 people killed after a tornado slammed into a neighborhood.
We took shelter, just my son and I were here. We ran to the center of the house and got in the closet, and then it was gone as quick as it started.
Along the North Carolina coast, these boats are now piled on top of one another like toys in a tub.
Oh my gosh!
In New Jersey, the powerful winds toppling the steeple of this church. And our cameras capturing the moment a sparking power line exploded just as ABC's Stephanie Ramos was conducting an interview.
This is basically a result of the storm. Power lines down, causing fires and explosions in the neighborhood.
Meanwhile, at the New Jersey shore, many vacationers are taking the storm in stride.
As with everything else in 2020, we had a storm to contend with.
When we come back, we'll have this morning's entertainment headlines and taking a look down or outside now. There we go. We're seeing our WDIO tower cams. Sun is starting to come up there over Lake Superior. Looking like a nice day. We'll have your forecast. Plus, we've missed many of the blockbusters supposed to be released this summer. But Disney is going to release one of their anticipated movies. We'll share how next.
to delegated entities around the state, local public health or other groups that have taken regulated delegation orders from MDH. So all of those complaints have been followed up on. Some have involved field investigations, but it's been an important source of information for us as to where the public is noting concerns, and we're able to follow up and make sure that both proprietors and patrons are aware of what the rules are. In terms of testing, I mentioned today's increase of 629 cases. That was on a testing volume of 11,718 total tests processed yesterday. That was an increase from the prior day. The 7-day average test positivity rate has now inched up to 5.2%. That's up from 4.9% a week ago. And we keep looking also at the relationship between the growth in testing and the growth in total cases. And the gap in those two numbers has narrowed pretty substantially over the last few weeks. Over the past week, we saw a total growth in testing of 9.9% versus the week prior. There were 12.7% more tests conducted in that week. This week, we've had 9.1% growth in new cases over the prior week, and the prior week that was 10.0. So both of those growth numbers have fallen just a little bit. Today, we'd like to have our special focus be on vaccine preventable disease concerns. I'm joined on the call by Margot Roddy, who is the section manager for the Vaccine Preventable Disease section within the Infectious Disease Division at MDH. And this week's cooler weather is certainly a reminder that fall is on the horizon, and that means flu season is coming. As we approach the fall, we want to highlight the fact that immunizations of a variety of kinds for both children and adults are such a critical tool to help us limit the overall burden of illness in our state, as well as the healthcare needs that translates to, including hospitalizations all across our state. And as we've said, we believe we're still many months away from having a COVID-19 vaccine available, but we do have safe and effective vaccines for many other illnesses that can present very serious risks and consume a lot of very needed healthcare resources. So maintaining high levels of immunization coverage is absolutely critical to preventing additional outbreaks of multiple kinds in our communities, in our schools, and our childcare settings during the COVID-19 pandemic. Unfortunately, one of the real consequences of the pandemic that we've seen, and we've talked about this on prior calls, is a drop in immunization coverage overall among children. We believe that the various restrictions on travel and interaction, the stay-at-home orders, concerns that folks have had about COVID-19, concerns about going into healthcare settings, and other factors are believed to have contributed to decreased immunizations among children in Minnesota and really across the whole country. While it's good that progress is being made to get back up to routine levels of vaccination for young Minnesotans, we have seen improvements recently in the vaccination levels for Minnesotans 2 years of age and younger. There's still work to do to provide catch-up for this very critical age group. And there's a lot of work to be done also with vaccination for school-age children and adolescents. We've seen decreases in the vaccination doses given in these age groups of over 30% comparing 2020 to 2019. And we've also seen a decrease in vaccine ordering through our Vaccines for Children program. So the State Health Department is working hard with our healthcare partners, our providers, school nurses, other partners, to encourage them and parents to make sure that children are getting all the vaccinations they need. So I just want to, again, urge Minnesota parents to take the time to review your children's immunization status and make sure your kids are up to date on their vaccines. You can call the State Health Department at 651-201-3980 or visit our website at health.state.mn.us/immunize to request a copy of your children's current immunization record. Again, vaccines are one of the most significant tools that we have to protect the overall health of all of our children in our communities. Well-child visits where immunizations and other developmental screenings happen are still and always have been considered essential visits. Vaccines are recommended at times when they will provide the best protection and when babies are at most risk. Delaying vaccines can leave kids vulnerable to serious preventable diseases. Keeping babies on schedule with their immunizations is important so that they don't have to catch up on their vaccinations later, as we could be at risk for outbreaks from other diseases if children are left unprotected. Now, we know part of the issue may be concern about seeking care at a clinic or other healthcare facility during a pandemic. And we want to emphasize that our providers have worked very hard to make it safe for patients to access the care they need, including well child care. Many clinics and health systems are finding creative ways to help make sure these important screenings and medical services still happen so that kids don't fall behind. Things like in-home visits, drive-up clinics, and designating certain hours or rooms for these well child visits to happen. Also, cost should not be a barrier to getting a vaccination. We have programs to help parents get their children vaccinated, and we have programs to help adults who need help with the cost of vaccination as well. Because again, vaccines are not just for children. We want to urge our older residents to make sure they're current on the vaccines recommended for them, such as pneumococcal and shingles vaccines. And as we've talked about several times already, and we'll certainly talk more in the weeks to come, it's going to be so critical for Minnesotans to get their flu shots this fall as a real significant way of helping us to manage healthcare capacity in preparation for what we expect to be additional cases of COVID-19 this fall as well. With that, Mike, I'll turn it back to you to open for questions.
Thank you, Commissioner. Operator, we're ready for questions.
As a reminder, to ask a question, you will need to press *1 on your telephone. To withdraw your question, press the # key. Please stand by while we compile the Q&A roster. Thank you. The first question will come from the line of Kate Roddatz of WCCO Television. Your line is open.
Thank you, Commissioner. I was curious if you could talk more specifically about where we are at with testing. We still do hear from people that say, they're having trouble getting a test. Are we testing at the capacity we need to be, or where are we at there?
Sure, Kate. It's a good question, and we know it continues to be a question for a lot of folks. We have built up capacity, as we've announced before. We have the capacity to test about 20,000 tests a day, but we're not fully utilizing that capacity, partly because, and I should say we have that capacity if the supplies are available to be able to fully use the laboratory capacity that's been built. So as we've talked before, can be a fairly complicated chain of events about whether the right reagents are in supply, whether the right viral transport media, and some of the physical parts of the testing machines. So there can be a mismatch on a day-to-day or week-to-week basis between what the labs can do theoretically versus how many supplies they have on hand that day. And with the resurgence or the reappearance of supply chain shortages worldwide and in the U.S., that's become, unfortunately, more of an issue again. We are doing our best to move supplies around the state through the testing command center that we've talked about before, but it's not always a seamless process. So we do know that some providers, because of their own individual system supply shortages, have had to cut back on their testing ability. Some have less kind of walk-in or drive-up capability than they had. Some are prioritizing patients who have procedures scheduled and the like. So we do appreciate that sometimes it's not as easy to just walk in and get a test wherever you typically would. That's why we continue to urge people to visit the state website to look for other sites. We do our best to keep that information current on a day-to-day basis so that folks can find a testing site, hopefully relatively near them, that is posting current information as of that day as to what patients are able to get tested at that site. So we're doing our best to work on those supply chain challenges, and we do. It is our goal to build capacity even beyond where it is now, as we talk about kids getting back to school and the need for more of the kind of community testing that we've done in recent weeks, bringing testing out to certain communities, certain populations that haven't been tested at as high level as we would like them to be.
Thank you. Just one more question. You know, we talked a month ago about you were seeing these outbreaks in bars and restaurants, and we talked about younger people going out. Are there any types of events now in particular that you've noticed have created maybe potential outbreaks, or any that you are a little concerned about that could do that?
Well, I think as we talked about, it's kind of social gatherings and larger gatherings in general that have been the problem. Bars and restaurants being a particularly large subset of that gathering place category, if you will. But we've also seen clusters emerge out of family events, concerts, gatherings, sporting events, socializing after sporting events. So in general, the fact that folks are gathering in larger numbers and not paying real close attention to the social distancing guidance, and is why we just keep reinforcing how very important it is to not just think everything's back to normal and we can socialize without any constraints, because clearly crowded places and close interactions over a sustained period of time, even outdoors, can be an issue.
Thank you.
The next question will come from the line of Jeremy Olson of Star Tribune. Your line is open.
Hi, I was wondering if you'd talk a little bit about the role of improved treatment of COVID, and whether, when you're talking about these daily numbers and test numbers versus deaths, if you're seeing anything in the numbers that says to you, yeah, we're getting better at treating this and caring for patients that come down with severe cases.
Yeah, Jeremy, I think last week when we had Dr. Maurice and Dr. Shacker on the line, I think Dr. Shacker in particular talked about some of the treatment advances that we've seen with remdesivir and dexamethasone, steroidal treatment, that have had pretty encouraging results. As well, just the greater experience that our clinicians have had treating patients, getting them started on different forms of oxygen therapy earlier in the course of treatment seems to be helping to avoid the need for ventilation in ICU. So I think it's both the therapeutics, but also just sort of the management of cases coming through as people have gained more experience that do seem to have helped improve outcomes among those who get a more severe case of the disease. But certainly that work is urgently needed to continue to evolve on the treatment front.
And as a follow-up on that, Chris had made a call for more blood donors, but specifically plasma donors for convalescent plasma therapy. And Mayo Clinic, some early results kind of leaked out today showing that it appears to be working. So you've got this plasma option kind of centered right here in your backyard. I wonder if you had any thoughts on that as a potential to be a solution.
Well, certainly we're grateful that we're that we are Minnesota's Mayo's home state, and that we are in a great position to partner closely with them to take full advantage of all that they're learning. And that's in fact part of what we were so excited about with the testing partnership between Mayo and the U, that the two of them are collaborating even more closely on some of the research front around the testing and treatment. But yes, Mayo's work on convalescent plasma is really encouraging. I know they're very enthused about it, and it has been shown to work in other types of illness. So I think there was good hope that it might also be successful for COVID, and it's great to hear that some of the early results are in fact encouraging.
Thank you.
The next question will come from the line of Catherine Bichert of MN Public Radio. Your line is open.
Hi, I was hoping, well, actually, first, I just want to ask a clarifying question on the first one about testing and testing supplies. Have you officially changed the guidance on who should get tested? I think the last time I looked, it was anyone who'd had an exposure is eligible for testing, even if they don't have symptoms. Has that officially changed?
No, I think that still is the basic guidance. We continue to point out priority groups of folks that should be considered as essential workers, including child care workers and school personnel as essential workforce. So, but in terms of, we've always suggested prioritizing people who have been symptomatic, of course. But more recently, as you say, we've updated the guidance to include asymptomatic people who believe that they, either for sure, who've been told that they've had an exposure. That's been the case for quite a while, but that we do encourage testing of people who believe they may have been exposed because of their participation in large group events.
Okay, and separate question. This group that you report on daily of confirmed a community transmission, no known transmission. So people who get it while out in the community, they don't know where they got it. There's no clear direct line. Can you tell us more about what we know about that group? Are these folks who are all out and about doing a lot of stuff? Maybe they're not going to a bar, but they're, going out a lot to do whatever that thing might be? Or are these people who are really still staying at home, wearing masks, only going out for grocery shopping? What do we know about that group?
That's a great question. We can report back in more detail on in a future call. I doubt that Margot, who's on the line with me, probably doesn't have that data at her fingertips. Chris Erzman impresses us all every day with her ability to call up any kind of data at the spur of the moment. Yeah. So we will get back to you on a better breakdown. But I have seen some summary data that indicate that a pretty significant proportion of the folks who are in that category of community spread are reporting kind of multiple potential sources of exposure. So they'll say within the last, week before they got tested, they'd been to several restaurants and a couple bars and a sporting event and a concert and a party in the backyard. So there are certain percent of folks who are doing multiple things. But that community spread category does include, as we said, entertainment venues of a variety of sorts, as well as family gatherings and other types of events.
Okay, I'll follow up for more information on that. Thank you.
Great. We'll get that to you. Thanks.
The next question will come from the line of Bill Werner of Minnesota NewNet. Your line is open.
Thank you. Commissioner, I'm probably not telling you anything you don't know, that a fairly good number of Minnesotans are headed to Sturgis or plan to go there. Are you discouraging people from going at all, or if the impulse is irresistible? Should they quarantine themselves when they come back, or are there precautions that they could take, possibly at such a large gathering, to reduce their risk? If you can kind of do the general review of this for us.
Yeah, well, certainly it's, I think, disappointing that that the decision was made to go ahead with the event at a time when South Dakota has seen a significant upsurge in cases, and we know that this draws people from many states, and so there are people coming into the event from high incidence states, and it's just a pretty ripe environment for further spread and folks bringing the virus back to their home communities. So, we've definitely been doing everything we can to encourage, especially people in higher risk groups, to really think seriously about the wisdom of attending, and certainly if they do attend, to try to avoid those prolonged contacts in close quarters, which is hard to do in an event like that. We acknowledge that. So certainly urging people to take precautions, be thoughtful, and when they come home, as we often say, it's not just the risk to yourself, but your ability to spread the virus to people who may be at higher risk than you may consider yourself to be. So it would be really prudent and a really very thoughtful thing to do for people to quarantine if they do go to Sturgis and come back, and certainly be vigilant and watch for symptoms and get tested. Consider getting tested 5 to 7 days after you get back, even if you don't have symptoms, but to stay away from other people for that period of time would be a really thoughtful thing to do.
Commissioner, just to clarify, what would be an appropriate quarantine in this particular case? If people were able to do it or willing to do it, is it similar to other quarantines, or can you just review that information quickly for us again, if you don't mind?
Yeah, I think the guidance has been to quarantine for 14 days. That is the kind of the long end of the most typical incubation cycle. So that would be the recommendation, to quarantine for 14 days. I know there have been some discussions about updating that guidance. I've not seen or heard anything specific to to an event of this particular type. But if there is anything of that nature to share, we certainly will get that word out. But 14 days would still be the recommendation.
Thank you very much, Commissioner.
The next question will come from the line of Chris Megan of Pioneer Press. Your line is open.
Hi, Commissioner. I also have a question about testing. Specifically, I've seen quite a bit about these sort of mail-in tests that people can order online and do a nasal swab and send them in. And I'm just wondering, it doesn't appear that they have emergency FDA approval. And I was sort of wondering what the department's position was on that type of testing. And then also I wanted to ask the status of the antibody tests and whether or not those are being widely used yet.
Certainly with respect to the proliferation of various types of tests, we think it's really important for folks to talk with their healthcare providers about what tests are reliable and what perhaps are not. There certainly are lots of tests in development, and that's a good thing, but we do think it's important for tests to go through the full FDA approval process, ideally not only the emergency use authorization process, but to be fully vetted by the FDA. I know there are a variety of mail-in tests. We're not specifically encouraging any form of test. We have talked a little bit about a particular form of FDA-approved saliva testing that we are looking at incorporating into the Minnesota program, and we can tell you more about that in the coming days. But in terms of home-administered mail-in nasal swab tests, I'm not aware that any of those have been particularly vetted yet. And in terms of antibody testing, as we've talked about, there are a number of those coming on the market. Certainly the antibody tests that Mayo and the university are using are we think, high-quality tests. And they are using those in particular situations, but they're not at this point in time widely in use for diagnostic testing. They're more in use at this point to help identify prevalence of exposure in a population.
Okay, thank you. The saliva test, is that the same as the rapid test, and is that going to be available soon in Minnesota?
I don't know what you mean by rapid test. It's not an instant test. The test that we've talked about in the context of making tests available for teachers that was part of the announcement on testing plans for schools both for school settings where there may have been, a certain number of cases would trigger a certain level of testing, but in addition, the ability for educators to get access to a saliva test as an adjunct to tests that they would otherwise be able to get through their providers. So that was a specific type of mail-in saliva test in partnership with Rutgers.
Okay.
Operator, we have time for one more question.
This has been a WDIO News Special Report.